Now, from lacing up for the cause to taking action on your health, October's Breast Cancer Awareness Month. If you're not sure if you're due for a mammogram or what your screening options are, now's the time to find out. Joining us is Dr. Zachary Hughs, Regional Breast Imaging Lead for RVH. Now, first question right off the bat, who should be getting screened for breast cancer and how often?
Right. So we have our Ontario Breast Screening Program, the OBSP, in the province, and we set out guidelines about who is eligible for breast screening. For the most part, that is women, two-spirited people, trans people, and non-binary people between the age of 40 and 74. There are additional criteria that can kind of rule you in or rule you out, but for the vast majority of people who fall into that category, you are eligible for breast screening in our province.
So the key is the tissue, the makeup of the breast. Why that age?
It's a good question, and things have actually changed recently. It's only been a shorter amount of time that we've offered screening for individuals between 40 and 50. But these are the ages where screening is the most beneficial. So the goal of screening is to save lives, and we do that by detecting breast cancers early, before you'd ever have symptoms from a breast cancer, before there'd be a lump in the breast or kind of any other sign that would tell you that you might have a cancer. And the goal there is to be able to treat these cancers both earlier, but also in less invasive ways if they're caught earlier on the basis of that screening. And so we chose that age group as the group that will benefit the most from a screening program. And for most people in between those ages, it's once every 2 years that you'll get a screening mammogram to kind of keep up to date.
Now, new survey data from Breast Cancer Canada shows 97% of Canadians believe more progress is needed in breast cancer care. What technological advances have been made at RVH?
That's a good question. So we have actually in recent years upgraded our mammogram units, and it provides a few benefits. So number one, we now have the technology to do 3D mammogram, which we call tomosynthesis, which basically allows us, instead of looking at a mammogram as one picture, it lets us look at individual slices of the breast. So it actually helps us be more confident in our diagnoses. And another benefit it provides is a bit more comfort for patients as well. So the breast is compressed when we take images, and that's in order to, it's a measure we use to get better pictures. But the upgraded machines that we have this curved compression surface that makes things more comfortable. So it's provided us a lot of benefits, really.
Okay, well, thank you so much.